Eugeria Live, brought to you by Griswold Home Care. Eugeria is a Greek word meaning health of body and mind in aging individuals. Eugeria Live is a weekly show celebrating the heroes that contribute to the Eugeria of our elderly and disabled population. Now, joining us in the studio are your hosts, John Butler and Sam Grass.
Welcome to another edition of Eugeria Live, where we discuss the health and well-being in our senior population. Joining today is our guest host, John Butler. Hi, John.
Hey, everybody. Glad to have you with us. As you may know, Griswold Home Care has been providing consistently excellent care all over the metro Atlanta area for 28 years. And one of the things we strive to do on a consistent basis, regular basis, is to provide services and information to seniors, whether or not it has anything to do with home care, just to help people that are going through the process of aging in their families, to give them some tools that they can use to do that job better and more effectively. And consistent with that is our special guest today, Hugh Henderson, who is a friend of mine, a professional that I've known for years. He's a great guy. He's the owner of Capstone Hospice, one of the best hospice companies in Atlanta. And I'm really thrilled to have Hugh with us today.
Thank you, John.
Today, because of the pandemic, everybody is off balance about everything in their lives, and particularly about healthcare issues, especially with seniors. And there's already been some misunderstanding, I think, about hospice. So what would you tell us about what hospice is like today during this pandemic?
Well, I don't know the exact correlation, but I will tell you that since March, when COVID really hit, we have been busier than ever. And these have been the busiest 6 months that we've ever had in our 5-year existence. So what that tells me is that people have been able to more clearly see the benefit of hospice with COVID. And that's been one of the few, if only, if any, positives that have come out of this. I think that people have a much greater appreciation for the difference that hospice can make with COVID, as far as just access to their loved ones and keeping an eye on them and monitoring things.
You think people are understanding better about what hospice really is and when to call in hospice? Because for a long time, it was just something that people avoided like the plague for some reason.
Yeah, I will take a glass half full approach and say, yes, I do think people are understanding it better, but I would say it's only incrementally better. There's still a long way to go. It's roughly almost 50% of hospice patients live less than 30 days. And almost 30% are less than 7 days. So, and the benefit itself is for someone who has a 6-month or 180-day life expectancy. So that tells you kind of where we are nationally, but believe it or not, that has improved some, but we still have a long way to go.
Do you think that the reason that the acceptance is low or less is because of the psychological effect of hospice coming in? And if so, then how do you counteract that?
Yeah, so I would agree with you 100%, Sam. I think that the main reason why is the psychological. It is not a clinical reason why people are resistant. In fact, from a care standpoint, they're actually going to get more care than they were receiving before. And they're going to have more licensed clinicians that are checking in with them on a regular basis. So there's not really a care need for it. I think what happens is that if you had to condense it down to what is, the average Joe public, let's say, what is their definition of hospice? They're going to say that it is a place that you go when you have cancer and you have less than a week to live. That is unfortunately what most people think hospice is, and it is so much more than that. It is not a place, it's a concept of care. It is not for the last week of life. It is for the last 6 months and maybe more. We've had people, and it is the exception, but there are some disease processes are much slower, especially the neurological diseases, and those are much harder to predict. So people have been on hospice for years at a time. And then finally, it's for all diagnoses, not just cancer. So that's the battle. The good news is it's rare to find someone today that hasn't heard of hospice. The bad news is there's still a lot of erroneous definitions out there of what people have and what hospice is and does.
So it is an emotional issue with most people.
Mm-hmm.
And if a family member, or even for that matter, a professional healthcare worker that's so reluctant to even bring the topic up, if there's some way they could step back and think objectively about really what they ought to be considering for their loved one or their patient, what would you say would be the time? What would be the trigger to say, okay, it's time to at least talk to somebody with hospice?
I would say if you're considering it, it's time. And it's probably past the time. I would say to be proactive. Again, you talked about looking at it objectively. The one of the difficulties is that this comes at a very emotional time in people, and getting people to think objectively at this point is very difficult. Objectively speaking, there is really no downside to hospice. The only downside would be is if you are actively pursuing an aggressive curative type of treatment, and the classic example is just active chemotherapy or radiation that is curative in nature, not palliative in nature, but curative in nature, then hospice is not a good option for you. And but that would be the only exception to where everyone else is, and to step back and objectively say, how is the care going to look different with hospice involved versus not having hospice involved? There's just going to be a long list of on the pro side, there's going to be check marks. And on the negative side, there really aren't any. So admittedly, I'm biased, but I've just seen it too many times in my almost 30 years of doing this, just the difference it can make with people, and the way that people can have just such that extra level of support and comfort that they need at a time when they need it the most.
Yeah, and you're right. I've seen this too. I don't know the statistics, but the vast majority, it seems to me, of people just simply wait too long before they actually bring in hospice, and then they realize, I should have done this a long time ago.
And in fact, that's some of the feedback that we get regularly is, I wish I would have known about you guys sooner. And so that's not uncommon for us to get that type of feedback.
Is there anything about providing hospice services or receiving hospice services that are more risky now with the virus in place than they were before? Is there anything like that at all?
No, I mean, the COVID-19 has changed the world for everybody. So you're practicing the precautions that come with that. I mean, maybe it's more risky for a healthcare worker in the sense that for us, we specialize a lot in working with assisted living facilities, and those are the ones that are the most vulnerable to the pandemic. And so we've got people going in and out of there a lot more. But I would say the risk is more on our side than theirs, with people, with all the PPE that people are wearing and that type of thing. The risk of us infecting someone is virtually non-existent.
That's really helpful. It's very good information. And I appreciate very much you taking the time to share that information with us.
Mm-hmm.
Hugh, I have a lot of great respect for you and for Capstone Hospice from all I know about you. What is the one thing about Capstone that sets you apart, or that you're most proud of about Capstone Hospice?
Well, those are two questions. You got me. What sets us apart and what am I most proud of? So I would say what sets us apart, really, it's not just one thing, it's a couple of things. One would be, though, that we are locally owned and operated. And what that allows us is to be very nimble, to adapt quickly to what the needs of our customers are. And so that is certainly what I feel is an advantage that we have. The other thing would be, part of that and related to that is the accessibility to our nurses, that our nurses carry on market average a significantly lower caseload. I would say arguably 30 to 40% lower than what some of our competitors are. And we try to staff them geographically where they're as close to people as possible. Those two things together make our nurses, they have the bandwidth within their day and the capacity within their week to respond to needs quickly. And then lastly, I would just say that our faith-based approach, that we try to treat our patients and their families as well as our employees in a way that is consistent with what you would see in just a Judeo-Christian historical framework. And we try to practice those things. So those three things I would say set us apart. What I'm most proud of would be the fact that we have grown, that with our growth, we have not sacrificed our culture. And that has been a challenge to maintain the culture with the growth, but I'm proud to say that we have done that. And so that would be what I'm most proud of.
That's great. Thank you so much for that. And I've been around your whole staff enough to see that culture. It's pretty remarkable, actually.
Yeah, you came to our holiday party last year.
Yeah, you guys really impressed me. Just the family environment of the whole thing was great.
Unfortunately, I don't think we're going to be able to have one this year.
Yeah, I'm afraid not. So if there's one tip that you'll leave our audience with, just whatever that might be, a thought or a tip that could be helpful to them, what would that be?
Yeah, I would say to be proactive with your or your loved one's position in approaching the topic of hospice. In fact, they may be very relieved the fact that you're bringing it up and they don't have to. And you certainly, as we've already discussed, you want to be on the early side of better to be too soon than too late in bringing hospice into the picture. So I would just encourage people to be proactive and just to ask the physician, if you think it may be a good option, say, what do you think about this? Is mom ready for this now? Or, what should we do? And so that would be my tip.
That's awesome. That's great advice. Well, Hugh, thank you again for being with us, and we appreciate your wisdom and the information that you've shared, and I look forward to seeing you soon, if not person to person, but at least virtually, right? So,
well, thank you guys. I appreciate all the fine work that you do too, and you guys are great partners to work with seniors, and I just appreciate all the great work that Griswold does as well.
Great. Thanks again.
Thanks, guys.
Eugeria Live is brought to you by Griswold Home Care. View this show again on YouTube, Facebook, LinkedIn, or our website at www.eugerialive.com.